So almost 2 years ago, at the launch of the Public Health Committee, a local restaurant, I spoke with many of you all about the need for air quality monitoring in Southern Maryland, because at that time, there were 25 air monitoring stations throughout the state of Maryland, but there were 0 in St. Mary's County. And the only other ones that were in Southern Maryland were operating part-time and only monitoring certain pollutants. However, it's important to remember that the EPA, pursuant to the Clean Air Act, sets air quality standards that limit 6 common pollutants: ozone, lead, particulate matter, sulfur dioxide, nitrogen dioxide, and carbon monoxide. Why are these important? These pollutants that are found in air around the country, around the world, have been clearly linked to the degradation of public health. Not to mention environmental damage and damage to property. So another relevant pollutant that has been linked to public health outcomes are VOCs, or volatile organic compounds. And at the close of that meeting and through the next couple of years, through partnership and collaboration between the Sierra Club and the NAACP, as well as the support of more than half a dozen other local organizations, including the Patuxent Tidewater Land Trust, the St. Mary's College of Southern Maryland Sierra Student Coalition, and many more, we are really, really proud and excited that our St. Mary's County Health Department has installed one of the most sweeping and incredible air monitoring networks that we really could have ever dreamed of. So I'm beyond thrilled to be here tonight to share with you and learn from our public health experts in the House. So without further ado, let me turn things over to my friend and colleague, Michelle Pottinger. She's a fellow NAACP Public Health Committee member. Yes, there she is. Hey, Michelle. And Michelle is also, in her professional life, a coordinator of special programs and the asthma and lead program at St. Mary's Health Department, as well as occupational therapist at MedStar St. Mary's Hospital. So I'm so pleased to be here with you tonight, and I want to turn things over to you and get this program started.
All right. Thank you, Rosa, for everything in the introduction. So good evening, everyone. My name is Michelle Pottinger, and tonight it is with great pleasure that I introduce our guest speaker of the night, Dr. Mina Brewster from the St. Mary's County Health Department. Appointed by the State of Maryland Secretary of Health upon recommendation of the Commissioners of St. Mary's County, the St. Mary's County Health Officer directs the St. Mary's County Health Department, provides medical guidance in public health decision-making, and represents the county and health department on a variety of local, state, and national committees addressing health. Dr. Brewster began her role as the St. Mary's County Health Officer in December of 2012. Prior to her current role, the Medical Director for the Health and Human Services Commission at the Indiana State Department of Health, and as the Chronic Disease Director for the state, overseeing a variety of efforts to address statewide public health concerns. Her previous work experience also includes appointments as Assistant Professor of Clinical Family Medicine at the Indiana University School of Medicine, where she taught medical students, primary care residents, and sports medicine fellows while providing clinical care to patients of all ages and backgrounds. She is a primary care physician with clinical training in the specialties of family medicine and sports medicine. In addition to outpatient and inpatient clinical primary care, she has served as a team physician for different levels of athletics and provided sports medicine coverage for a variety of athletic events. Her research, presentation, and publication activities cover topics relevant to public health, primary care, and sports medicine. She has a strong interest in wellness, health promotion, and evidence-based public health action. Dr. Brewster earned a Bachelor's of Science in Biology, Master of Public Health, and Doctor from the University of Miami, Florida. She grew up in central Pennsylvania and lived in Florida and Indiana prior to moving her family to St. Mary's County. Tonight, she will be discussing new comprehensive air quality monitoring and health education initiative, Breathe Well St. Mary's. This is just a brief synopsis of all the great accomplishments and strides that Dr. Brewster and the St. Mary's County Health Department has done for our community. We thank you for all hard work and efforts. County Health Department.
Hello. Hi, everyone. Are you okay? Are you able to hear me?
Yes, we can hear you.
Great. Excellent. Thanks so much for that introduction, Michelle. I appreciate it. And thanks to everybody who's taken the time to tune in today and hear a little bit more about this awesome new initiative we've rolled out here for our county. And I think it's going to be a great step forward. And as Rosa was describing earlier, it really is one of the most comprehensive air quality initiatives, monitoring initiatives, and we're hoping that it will grow and encourage a lot of thought and discussion and action here at the local level for St. Mary's County benefit. Actually developed some visuals to guide us along. And, you know, again, just want to recognize that the Breathe Well St. Mary's initiative came out during a time where we've been dealing with the COVID pandemic. And some of what we've learned during the COVID pandemic is what moved us into this realm. And then also, if you go to the next slide, please, we worked very, very closely with our partners, specifically the St. Mary's County Public Schools, the St. Mary's County Sheriff's Office, to get this going. And then really also appreciate all the involvement of the Southern Maryland chapter of the Sierra Club, the University of Maryland, who provided a lot of technical guidance to us while we developed this initiative, and then also to St. Mary's College of Medicine, St. Mary's College of Maryland, who also provided a lot of technical assistance as well. So there's a whole group effort to get this going, a lot of great minds at the table who really wanted to see this initiative work out for St. Mary's County. If you advance to the next slide, I can't see the next slide, so there we go. Excellent, thank you. So as I mentioned, we started at about a year ago now. We developed the St. Mary's County Equity Task Force. And this was a partnership between the public schools, the Sheriff's Office, and the Health Department here in St. Mary's County. And our focus with this Equity Task Force was not just to do deep dives within our own organizations to make sure that we were taking the action necessary to promote equity within our own sectors, and also implementing policies and practices that promoted equity within our sectors and within our agencies, but that we would come together and we would identify some great collaborative action that we knew would make an impact on equity in all three of our sectors. The Breathe Well St. Mary's initiative actually came out of that, desire to work together to implement a needed and impactful action here for our residents in the county. The Breathe Well St. Mary's collaborative effort really focused on those four things that are listed over there up on the slide. And again, to promote good quality air for us here outdoors, to help people manage chronic lung issues that they may have, to promote good indoor air quality as well, because we don't just breathe air outdoors, we breathe the air inside our environments, including at work. And also to serve as a way to teach people about air quality and its impacts specifically on health. All of this was helping us work towards environmental justice and health equity, educational equity, equity in public safety, as we're pretty much all of the collaboratives that we launched through the Equity Task Force. So what I'll do is I'll talk a little bit more later about what specifically the Breathe Well St. Mary's initiative involved, but I want to talk a little bit about the issues that helped us get there. As I mentioned, we launched this as the COVID pandemic was started, so COVID was a major reason that got us going on this initiative. The other issue at hand that we have always been working on as a health department, and Michelle Pottinger who's on this call and has been incredibly instrumental at our health department in leading and providing leadership for that program and service through that program is on the issue of asthma. And so I'm going to explore those reasons first, COVID and asthma, and talk a little bit about health from those perspectives. If you go back to the COVID slide though first, talk a little bit more about those perspectives, and then I'll go further into the specific initiatives that we're doing with the Breathe Well St. Mary's initiative. So for COVID, why is this relevant to COVID? Well, actually, this came about and we really started looking at this deeply because of COVID. And that's because we were looking at two aspects of COVID-19. We were looking at the transmission of the virus between people and what was contributing to how the virus was getting transmitted between people. And then we were looking at the impact of the virus and how ill it was making people and what made people sicker and what were things to consider with people who had longer term impact from COVID. So the transmission piece, there's two elements to that. For indoor air, as you know, now, and as we were learning back when we were exploring this initiative, that the virus can be transmitted through the air, aerosolization, and as respiratory particles, the particles you might cough out or breathe out that get spread to a person that's, within a certain number of feet of you, within 6 feet of you typically. And that if we want to reduce the amount of COVID circulating in an indoor environment, sometimes it would be it's always helpful to increase ventilation in that space. And one way to increase ventilation is opening windows and so forth. But another way to filter the air environment is to use air purifiers to hopefully decrease the amount of COVID being transmitted in that indoor space. So that concept and that interest in looking at air purification and air filtration came from our concern about COVID transmission. The other aspect of COVID transmission is at the time when we were talking about this initiative and developing it, there was some early research coming out that seemed to suggest that poor outdoor air quality was actually causing worse COVID disease. And it may even be contributing to the transmission of COVID in communities. And so that is something we learned about in our scientific advisory group that we established here locally, our COVID scientific advisory group we established here locally in partnership with St. Mary's College. And as we were seeing some of this research come out, it certainly drew our attention to, do we need to be thinking about outdoor air quality when we're also thinking about how to suppress the transmission of COVID? The next part of COVID that really drove us here was its impact as a disease, right? As the illness that it was causing in our residents. We knew that people with poor lung function, right, or they have lung disease like asthma or COPD, were at higher risk from having worse illness from COVID. So for somebody with COPD, chronic obstructive pulmonary disease, maybe they've had a history of smoking or whatever led to that COPD, they were at much higher risk of ending up in the hospital or getting really sick if they got COVID-19 virus. And that's something we were really concerned about. And we also knew that people with lung health issues like asthma or COPD or other issues, they have a harder time controlling their lung disease if they have poor air quality around them. If they're breathing polluted air, it makes it harder for them to get good control of their lung health. And if they can't get good control of their lung health, then they were at risk for worse disease with COVID. And so those connections were also a significant concern for us that prompted us to go in this direction. Lastly, we started learning about long COVID, what we call now as long COVID. We didn't call it long COVID back then because we were just learning about it. But we were learning that people some people with COVID infection would end up getting these long-term symptoms. It wouldn't just, the symptoms wouldn't just resolve. They would continue to have breathing problems. They would continue to have lung problems. They would continue to feel short of breath for months on end, possibly. And for those people who had these long-term kind of consequences or impact from COVID illness, we knew that air pollution and poor air quality would make it harder for them to breathe well or to have control over their long-term COVID symptoms. So if you go to the next slide, please. So those are the COVID reasons. The other reasons that we've always been interested in here in our county, way before COVID, is asthma. So asthma has been recognized nationally as the #1 reason for missed days of school. So just think about that. Asthma nationally has been identified as the #1 reason for missed days of school. That makes air quality, which affects asthma, an environmental justice issue. That makes asthma, because people, your air quality varies by where you live, may vary by where you live. And if it varies by where you live and it's impacting some people more than others, particularly some people with asthma more than others with asthma in other areas where air quality may be different, then where you live is impacting your ability to participate in school and do well in school and have positive educational outcomes, which then may lead to positive work outcomes and finances and so forth. So it has this whole domino effect in society. And so that's why it becomes air quality and asthma become an environmental justice issue related to, specifically to this aspect of asthma. It also becomes an educational equity issue, because if certain kids are missing more school because they are the ones that unfortunately have access to worse air quality, and they can't get good control of their asthma, partly because maybe they live in a more polluted environment, then they're the ones who are going to be disparately impacted and missing more days of school. And then their parents, it becomes a financial equity issue, because then their parents have to take time off of work, maybe lose their job because they're taking off a lot of time to take care of their sick kids or take their kids to the emergency department all the time, or keep them home so they're not in school when they're not feeling well. So, these things, again, they have domino effects in our community. And if we get to the root of these, of that domino effect, we can start to see that air quality really makes an impact. Now here in St. Mary's County, just over a 2-year period of time, we had nearly 4,000 asthma-related visits to the emergency department. Not just our local emergency department, these are just visits by St. Mary's County residents to emergency departments throughout the state. But you can start to see the disparities in that data too. So the majority of our population is 18 to 64. So of course, the majority of visits to the emergency department that are asthma related, about 70% or so of those nearly 4,000 visits were in adults in that 18 to 64 range. And then a smaller portion, about 9%, were in seniors. But it was nearly 20% of those asthma-related emergency department visits were happening in children under the age of 18. Nearly 20%. And so one emergency department visit in a school-age child is just one emergency department visit, but it might be associated with several missed days of school. It might be associated with other issues that they're dealing with, because of their asthma and their inability to control their asthma. And then when you look at the racial, ethnic disparities, it's even more concerning, because if you look at the statistics, well over 30%, nearly 35% of those emergency department visits were happening in African-American residents in our county. Whereas our county's population of African-American residents is about anywhere from 15 to 18% typically. So that's nearly double our population in terms of the proportion of those emergency department visits for asthma by race. And so then it becomes a racial disparity as well in utilization of the emergency department for uncontrolled asthma. So all these reasons are reasons, and all these statistics and description of need is why asthma in St. Mary's County is a public health issue, and why it's so important for us to do what we can to get better control of this largely, while asthma may be a chronic illness, the problems with asthma in many cases can be preventable if we get good control of the triggers that cause asthma attacks. All right, if you go to the next slide, please. Great. Before I go on, I do want to mention, especially as Michelle's on, and she's working very closely with this program, but that we do at the health department, we've been operating an asthma control program in the state. We were the second health department in the state to start something like this. The first one was coming out of Baltimore. And this program is incredible. I mean, it really has made such impact on the lives of children with asthma. We go into homes, we do an assessment of the environmental triggers within a home. We give out free stuff like mattress covers, pillow covers. We'll even give out a HEPA vacuum cleaner, which has a HEPA filter in it. We'll do education about how to properly use your medications, when to use your medications. We'll talk with primary care doctors who are prescribing things and give them feedback as well, and really work with that family over several visits so that that child with asthma who's between 2 and 18 gets much better control. And so there's less missing school, there's less parents missing work, and there's much better quality of life for everyone involved. So again, I'd really encourage, if you know anybody with asthma, you refer them in. If you work with any clients or patients who have asthma, refer them in. If they're between the ages of 2 and 18 and they live here in St. Mary's County, it's free. And Michelle and her program team are steering all of this for our health department. So I really encourage you to take use of this free resource. It makes a huge difference. I mean, the data that we've had over the past 5 years of having implemented this program is dramatic. I mean, the drop in emergency department visits related to asthma for the people who participate in this program has been incredible. If you go to the next slide. So part of what we do with that program is look at triggers within the home and try to address those triggers within the home and give some tips and techniques and give health education and all of that. So those are things that are very relevant to controlling asthma. But outdoor air is also very relevant to controlling asthma, or indoor air is also very relevant to controlling asthma, as it is for other lung health issues like COPD and other types of lung health concerns. And so that very real impact of outdoor air, especially on lung health, is one that anybody who has asthma, who lives and breathes during high pollen season like we are now, in the spring especially, can tell you is a problem. It's like when you're outdoors and it's high allergy season like this, this is when it gets really tough for the people with really bad seasonal allergies or with asthma or with other kinds of conditions that are on that allergic type of spectrum. And this is particularly concerning for children because children, their lungs are still developing. And for seniors, because they have higher chances of having health problems that complicate their lung health. And also for people who already have lung health conditions like asthma and COPD. All these populations are especially vulnerable to the quality of our outdoor air. So Rosa was mentioning earlier the different types of lung pollutants. There are 6 what we call criteria pollutants that the EPA actually sets standards for. One of them, which is the one that I've featured here on this slide, is called particulate matter. And particulate matter isn't really about what the chemical is, it's more about the size of the particle. And the particle can be a solid or it could be a liquid, or it could be a virus, there's different sizes. And so PM stands for particulate matter, and PM10, PM2.5, et cetera, that's just talking about the size of it. So the PM10 are the larger pieces of particulate matter. I say larger really with quotes because it's a lot smaller than a human hair. In fact, about 5 or 6 of them could fit in one human hair, the diameter of one human hair, which is pretty significant. And so that typically is stuff like pollen, like I was just mentioning, that coarse particulate matter. And then there's fine particulate matter, which is the particles that are smaller than 2.5 micrometers in diameter. So again, really, really small. I mean, if you look at the slide here, the picture, it's the red dot compared to the blue dot, and the blue dot compared to one human hair, which is only about 50 to 70 micrometers there. Those smaller particles get to the very ends of your lungs. And that's especially troublesome for people who have asthma, because a lot of asthma will start in those ends of the lungs where it gets irritated and inflamed and starts causing an asthma attack. Can you move on to the next slide, please? And then what happens is that with this air pollution or air pollutants like particulate matter, we can actually we can actually figure out what's called an air quality index. So if you take one of these 6 pollutant criteria, or one of these criteria pollutants, like particulate matter, you can generate what's called an air quality index. It doesn't give you the value of the particulate matter. That value gets transcribed to something that's easier for people to understand. And there's like a whole formula it kicks into. And then your air quality index is what tells you, is it recommended for you to take certain protective actions to protect your lung health? So while you're out and about in that outdoor air, should you really be more careful about being in that outdoor air if the air quality index is particularly unhealthy or high? And different colors of air quality index would tell you that, hey, maybe if you're in one of these groups, maybe you shouldn't be doing your recess outside. Maybe you should do an indoor recess instead. Go to the next slide. So now I'm going to talk briefly about the different parts of our St. Mary's Breathe Well initiative. And I'm extraordinarily grateful for the awesome partnerships that we have here in this county, because we really have pulled together to make this thing work on behalf of our residents and for the benefit of our residents. And like I said, the public schools, the sheriff's office, the health department, but then also the Southern Maryland chapter of the Sierra Club, the St. Mary's College of Maryland, and the University of Maryland all work together to make this come together. If you, when you're ready to restart and go back to that slide there, I'll go ahead and start. So the two kind of areas that I'll focus on for this Breathe Well initiative, and that link down there is the website. We'll go to it in a moment. The big part is the outdoor air quality monitoring. So that's all that stuff I was talking about, including particulate matter. What we were really concerned about was especially around schools, because we knew that air pollution affects asthma control, and asthma, nationally at least, is the number one reason for missed days of school. And so we were really concerned about the environment that children were in, especially outdoors when they were, in recess or doing activities outdoors. We also wanted good geographic distribution across the county, because we were concerned about environmental justice. It's not just one part of the county where we're concerned about air quality. We're concerned about air quality for everyone in the county. And so we wanted to make sure that the placement of air quality monitors was accessible and was beneficial for all parts of the county. And so we decided to install these low-cost air quality monitors for particulate matter. They're called purple air sensors on each of the public schools. So now every public school has these air quality sensors on it that are picking up on particulate matter. And then some locations also have some additional, they're measuring ozone and nitrogen dioxide, which I'll talk about in a moment. The measurements from these outdoor air quality monitors that are on all these schools, the data from that is being uploaded automatically onto a data dashboard that we created on the St. Mary's County Health Department website. And that data dashboard is accessible to everybody, inside the county, outside the county, whatever. You can find the spot that you're interested in. You can find the air quality index for that space. You can see what the temperature and the weather conditions are like, because weather conditions affect your air quality index. You can get resources and guidance as to what might be some protective actions you might need to consider if you fall within one of those vulnerable groups. So if you go to that website, whoever's managing, please, if you could go to that web page, the smchd.org Breathe Well web page. And that'll show you the data dashboard that we have developed so that anybody in the county can find the flag or that indicates on the map the site that's closest to them. Thank you. So if you scroll down, hopefully everybody can see this all right. And if not, just go to the website yourself, and hopefully somebody could put that up in the chat box on the Facebook Live. But you see that map down there, St. Mary's County. You see all those flags. Those flags represent those different monitors. There's a variety of them, but if you go down to the one that says purple air, those are the purple air sensors that are looking at particulate matter. And if you scroll all the way down, there's some additional, there's some additional measurements there you can check as well. So you click on a site, it'll show you the air quality index for that site, and you can take whatever protective action is recommended based on the air quality index. So that air quality index is doing all right. And I'm not sure I can't see which location that is, but you can see and it'll automatically update itself. It takes readings regularly throughout the day, and it'll update it based on the current weather conditions and the current sensing of pollutant that it's measuring. Now, this is all paired with school curriculum. So if you scroll down to the bottom of this page, there's some resources at the bottom, and there's also a flag right there. If you just look there, what we have done is we've partnered with the school system. They're actually working on curriculum right now that they'll roll out with this next school year. And that school curriculum is going to support environmental health literacy. And it's going to teach people what we call self-efficacy. And self-efficacy basically means that I have confidence in myself. And in health matters, I have confidence that I can manage my health condition, and I can learn what I need to learn so I can manage my own health condition. Thank you, NAACP, for posting that web link. That's what we want to teach kids. We want to teach kids confidence, that if they have asthma, they feel confident that they can learn what they need to learn and that they're in control of their illness, and that they can take action to help protect their health and promote their health. Because that's going to last a lifetime, is their confidence in their ability to manage their health. And so that's what this tool does. It actually teaches them about air quality. And the curriculum, hopefully that gets rolled out in the school, will teach everyone about air quality and the role that air quality plays in health. And it'll definitely teach students who have asthma or other conditions, including allergic conditions, the relevance of air quality to their health. A part of this curriculum is what we call Fly a Flag. We're really excited about this. Every school has these different colored flags that match up with the different level of air quality index, as you can see on this chart here. And we're hoping that the schools, especially the elementary schools where this can be a fun activity for different classes, is that they would take turns and they would check on the dashboard and look at the air quality index for their school for that day. And they would go grab the right color flag and they would fly that flag at the school so that everybody in that school would know what the air quality index is. And there's posters that we've made and distributed to the schools that they'll post indoors that'll say what the color flag means and what they need to be cautious of. And if it's a particularly tough day, then maybe a kid with asthma could have indoor recess instead of outdoor recess and better protect themselves from having an asthma problem. All right, if you go to the next slide, please. There are some, actually, before we go back to the slides, at the bottom here where it says additional resources, I do want to note, we're doing this in partnership with the public schools, but this is usable by anybody in the county, whether you're homeschooled or you go to a non-public school. Non-public schools and homeschool families can use this information and develop their own curriculum. And actually, in some of these additional resources at the bottom, we have links to some standard curriculum that you could use to teach your family or your child or your students these lessons using this data dashboard. Because like I said, these air quality monitors are all over the county now, so everybody will be close to something. All right, now if you go back to the slide set, I do also want to mention that we have other outdoor air quality sensors. The next slide. We do have other outdoor air quality sensors that we're using for other things like ozone. The one at the top measures ozone and nitrogen dioxide, and it is in certain locations. It's a little bit more expensive, so we weren't able to do it at every single school, but we tried to pick certain geographic regions throughout the county. And then we also have what's called a federal equivalent method sensor. And that's that trailer that you see the picture at the bottom. Basically, that's the more expensive outdoor air sensor, but that's the one that allows us to compare outdoor air quality in St. Mary's County to the outdoor air quality being measured in other jurisdictions across the state, as well as nationally, because those jurisdictions and national jurisdictions, that data is accessible to us because they're using federal equivalent method sensors. And so we wanted at least one of those in St. Mary's County so we could get on the map nationally. So this trailer is a really cool concept. It actually takes this federal equivalent method sensor and it rotates it in different locations throughout the county. And we partner with the sheriff's office on that work. If you go to the next slide. Measuring is great. Measuring and monitoring and data is going to get us really far in understanding and in the health education initiative that I described. But we also want to keep acting and use that in a way that is going to make an impact to decrease air pollution. And so part of this initiative is to work with the schools, particularly for no idling policies. So when you're waiting to pick up your kids, and you leave the car running, that exhaust is all collecting with all these cars lined up, the car is running and the exhaust is collecting. And what then happens is that, 6-year-old walking out of their school is now walking into a very polluted environment. And if that 6-year-old has asthma, it might trigger their asthma because they're walking into an environment where there's a bunch of cars all gathering and they're pushing out their exhaust while they're idling. And so we're encouraging our residents and especially our parents when they're picking up their kids as best as you can, please turn your engines off so we're not making it tough, especially on those littles that are coming out who have asthma. All right, okay. The next one. So the next component that I'll go through briefly is indoor air quality monitoring. And so we wanted to focus not just on the outdoor air quality, which is a big part of it, but like I said, half of our lives are and many times, especially in the wintertime, are spent indoors, if not more. And for our first responders, especially during a COVID pandemic, where we needed them every single hour of every day, we've relied upon our first responders so much. We wanted to make sure we were doing what we could to protect our first responders as best as we could from COVID transmission in their workplaces, their 24/7 facilities. We also wanted to make sure we protected our detention center from COVID transmission, because where people live in a congregate environment like a detention center, that's where we see a lot of these COVID outbreaks develop. And so we have installed indoor air quality monitoring sensors at certain locations, not everyone. We will get to that eventually, hopefully, if resources are available to be able to monitor indoor air quality at all first responder units. But we definitely have installed air purifiers or HEPA filters. And those HEPA filters are actually working to reduce the amount of COVID circulating in the air as well. And so those are located at a variety of those 24/7 first responder facilities and the detention center. And we also placed HEPA
Okay, I think that we lost Dr. Brewster. We're going to try and get her back up so she can finish her presentation. So just please be patient with us for a second. BJ, Rosa, and BJ, if you could bring Rosa and Michelle back up while we're trying to get Dr. Brewster back on.
Hey everyone. Oh, there she is.
Hi there. Sorry about that.
No problem.
I guess I wasn't paying attention to my battery. Apologies.
Oh,
All right. So what I was saying is we've installed HEPA filters at a variety of locations, including the county libraries and some of our 24/7 first responder facilities. It's good for COVID. It's good for asthma, and it's good for seasonal allergies too. So that's always important, especially during a season like this. If you go to the next slide, just really, again, to wrap up, the next slide just gives you the link to our website. So please consider checking it out if you want to learn a little bit more about it, if you want to check out our data dashboard and see what air quality index is like in your area. And if you want to find out more about our asthma program, it's you can go to www.smchd.org/asthma. And if somebody wouldn't mind putting that up in the chat box, that'd be great too. Or you can always ask Michelle. So thanks for your time, everyone. I'd be happy to answer any questions.
That was wonderful. I was over here. I feel like I was tearing up because this is such a big deal. I cannot express like how amazing this is, the thoroughness of the program. I'm just floored.
Well, COVID's been a super tough year and a half almost now for our whole world, and definitely for our community. But I will say there have been some amazing things coming out of the intense collaboration that we've had and we've been able to have during the COVID pandemic response. This is one of them for sure.
Yeah. Do we have any questions from the audience, or Shalmise, do you have some?
So I am they're trying to feed me questions now. So we'll see what pops up. BJ, are you able to bring Michelle back on?
While we do, let's hear it for Shalmise Hudson, RN Health Committee Chair, All-Star, zooming in from afar. You were awesome.
Thank you. So Dr. Brewster, I do have a couple of questions. So we talked about the different air monitors that are at different areas in the county. In the foreseeable future, do we see adding them in any other places?
We are definitely open to that. And one of the things we've communicated, actually, Rosa, with Sierra Club, we have communicated out that if other locations are identified that would help us be more thorough. We have a fairly good presence just by using all the public schools. It gives us pretty good representation across the whole county. But if we start to see that there's some pockets that could benefit from it, or maybe where they're located, there's certain concerns that might be there that people want to be even more on top of what the air quality index is. We would certainly consider adding additional air quality monitors. The purple air monitors that I talked about first that measure particulate matter, or PM, those are pretty low cost and very feasible to install. And like I said, we have the data dashboard set up now so people can very readily access that data. But if anybody's interested in a particular location and they have a reason why it's necessary for that location beyond, whatever the nearest public school is, I would encourage them to either reach out to us or reach out to the Sierra Club because we're in communication with the Sierra Club on that and are looking for their expertise and guidance on where else we might need to be looking for air quality monitoring.
Okay, great. And so I did hear that the number of emergency department visits reduced for the people that were taking part in the home visits with the health department. I think that is amazing. Are there any other things that you can suggest to help with the decrease in emergency department visits? Because I know we have a strong COPD community in St. Mary's County. the asthma, and then of course, like you were talking about, the long COVID syndrome that we're seeing with people. I noticed like the mattress pads and pillow covers. Are there any other recommendations that you're able to give?
Michelle could answer this brilliantly, I'm sure, and I'll add on whatever I can chime in on.
So with the asthma program, not only do we provide the families with durables, but we provide them with the asthma binder, which includes educational handouts on homemade cleaning solutions that they can use in the home. It provides information on different allergists and doctors that is in the St. Mary's County local community. We provide mattress and pillow encasements. We provide cleaning products that includes a mop, a duster. We also provide a HEPA filter vacuum cleaner, but our main focus is educating the families on ways to decrease the triggers and irritants in the home, as well as being aware of the warning signs of asthma and flare-ups to prevent them from going to urgent cares and ER. The main concern is making sure that they're aware of the education so they can not use the ER or the urgent cares as frequently.
Yeah.
Okay. And it looks
sorry, just to add on to that, I mean, a lot of this is about empowering people to manage their illness, right?
Mm-hmm.
It's a scary thing. Asthma, if you think for people who don't have asthma, think of breathing through a straw,
Yep.
right? I mean, that's what asthma feels like, especially when somebody is struggling and catching their breath because they're having an asthma attack. And people live like that. Some people who have uncontrolled asthma are constantly breathing through a straw.
Mm-hmm.
And so if you just imagine like what kind of impact that has on quality of life and their ability to focus on school and on work, I mean, it can be pretty tremendous. And it's tough for the family to see the children they love or their other loved ones, the adults that they love, struggle like this. And so there's a lot of ways that we can get asthma under control. And all the things that Michelle talked about. And then we work with the doctors too, to make sure that the plan that families have so that they can get the right steps in place early on before they end up to a level of seriousness that makes them go to the ED. We work with them on that plan as well.
Okay, so we're starting to get a couple of questions in. The first one, Michelle, Dr. Brewster, how does someone that has a child with asthma, how do they sign up for the home visit?
So in one of the PowerPoint, you can contact the health department. There is a criteria requirements in order to be enrolled in the program, but I can put in the information of the phone number to call, as well as my personal number. So if they qualify and they meet the criteria, we can get them enrolled in the program.
Okay, awesome. Second question, are there any other counties in Maryland that have air monitor systems?
There are, and maybe this is something Rosa can answer, but we are aware of other counties in Maryland that have certain air quality sensors. I'm not aware of any other jurisdiction that has as robust of an air quality monitoring network that we have here in this county, but maybe Rosa can talk more about that if she knows.
I think you're right, and my understanding that in Baltimore is probably the area that has the most concentration of air quality sensors. But in terms of robustness, I don't believe that there's any program that associates it with the local public school system, which I think is a unique benefit and definitely speaks to the principles of equity and environmental justice, ensuring that students are able to know what their air quality is like and be able to, like you said, advocate and help themselves.
Yeah. That's self-efficacy.
Yeah.
So the next question, are there any statistics that show if the air quality in St. Mary's County, have we been getting any data back yet that shows if the air is better or worse than other parts of Maryland?
Yeah, so we just rolled this initiative out fairly recently. So the air quality sensors really just got hooked up, I think, maybe a month ago. And, it took a while for the different schools because we had to get all the schools installed. So it was a period of time before all the schools were hooked up. And we're still trying to get certain county buildings connected as well to add more to that network. So we're just starting to monitor, and that's a great question, and that's a question we're going to pay attention to very closely. Is what are the differences in air quality index that we're seeing across the county, and why? Because that'll then get us to think about what might be the reasons for that, and are those reasons, or is that worse air quality in a certain part of the county associated with higher problems with asthma control or other things? We'll start asking those questions once we start getting this data over time.
Okay.
Good thinking.
Okay. And next question. Does the asthma program partner with the school system and school nurses? So I guess they want to know if we know that the air quality is better or worse, how are school nurses involved with helping to assist with the students?
That's a great question. I can talk a little bit, and then Michelle, if you have anything to add, that'd be great too. So yes, actually, when we rolled out the asthma control program a handful of years ago in this county, one of the first partners we reached out to was the public schools, because we knew all these kids, the vast majority of these kids that we wanted to reach and their families that we wanted to reach were involved in the public schools. And so we made sure that the school nurses at that time knew about our asthma control program, that information was sent home to families who might be interested in that resource when we had rolled it out, and that we would have some bi-directional communication in the sense that, when we communicated with a kid's doctor, we weren't just communicating with their doctor, we were also communicating with their school nurse, because half of that kid's life, for the most part, was being spent in a school environment. And we wanted to make sure that they had all the support they could have, not just in whatever home we visited, but on also the school and the school nurse that took care of them.
I agree. And just to piggyback off of Dr. Brewster, we do have partnerships with the doctor as well as the school nurses to have the families complete an asthma action plan, which is basically a blueprint that gives you guidelines on what to do and how to proceed if you're having particular asthma symptoms. And so the parents will complete that to have a copy in the home as well as at the school when needed.
Okay, thank you. Are there any facilities in neighboring counties that contribute to the air quality in St. Mary's County? So they're probably thinking about the treatment plant and the plant in Calvert County.
Yeah, and I can speak to this a little bit as well. Across the Patuxent River in Calvert County, there are 2 power plant facilities, and then right upstream of us on both the Patuxent side and the Potomac side, there are 2 coal-fired power plants. And I want to focus, I guess, more on the coal because coal has been demonstrated time and again to directly contribute to the health-harming pollutants that trigger asthma. Like there has been established a direct link between coal and asthma. While they're a little bit upstream from us, literally and figuratively, of course, wind blows. We are not too far away to be unaffected somehow. That's a great question.
Thank you. Other than asthma, what are some other symptoms that let you know that you're suffering from poor air quality?
So I can start. Allergies are certainly, so air quality, like you talked about, particulate matter includes things like dust and mold and pollen, natural things, right? As well as the things that are created synthetically because of, smokestacks and various other things that we have in our man-made environment. And there's other things as well. There's other types of criteria, air pollutants like lead and various things that are might involve some man-made substances. How do we know? I mean, problems with asthma are when people start getting symptoms of asthma, it might be similar to some of the kind of symptoms that other people may experience because of seasonal allergies or COPD flare-ups, cough. It might be some people just have a persistent cough, a dry cough usually, or a nighttime cough. They may have problems with allergies, even if they don't have asthma, and start getting the drainage and the itchy, watery eyes, and the dark circles and so forth, like mine, under their eyes. That can be an indicator of seasonal allergies. And so there's a lot of things, because asthma isn't, and it's not its own sphere. It's kind of on a continuum in a way of a lot of different kind of allergy and immunology type of issues, including eczema and seasonal allergies and all this kind of stuff. So there's a whole scope of symptoms people can experience related to allergies and asthma that kind of the typical ones that people think of as well.
Okay, and someone asked, are we considering putting any monitors, or will we consider putting any monitors at the fire departments?
Yes, so we would consider monitors. Right now we have air purifiers at some of the fire departments. I think one of the comments I saw pop up earlier was about flags in particular, and I thought that was a great idea, whoever put that idea out there. If the fire departments, that's brilliant. If the fire departments want to do flags, we would be happy to work with them on that. We'll have to make sure we identify the resources to purchase the flags, but as long as we can do that, we'll get all of our fire departments who are interested equipped with the flags so that they can fly the right flag for that air quality index for that day.
That would be great. That'd be great, because that'll also touch people who may not have school-age children, and so everyone drives past the fire department.
Absolutely, and it's a great place to look at flags. So
Yeah.
It makes sense, because they're monitoring, a lot of weather conditions, and weather conditions, including the dryness of the weather and so forth, actually factor into whatever the air quality index is for that day.
Okay. And I think this is going to be our last question. Why was St. Mary's chosen for these air monitors? And how, it's a multi-part question, I'm sorry. And how is the air quality worse off in St. Mary's, or is it just a new program being implemented?
Great question. And I'll answer the second part first, which is it is just a new program being implemented. So we're not sure yet what our air quality will be in St. Mary's compared to other jurisdictions, but we will definitely keep a very close eye on it. And why was St. Mary's chosen? Because we've got great partnerships here, and this was a partnership effort of a variety of groups coming together, like I talked about, to make this happen for our county. And great things happen when you have great partners working together.
Okay. And do we have time for one more question? Okay. So there is a connection between air contamination and water pollution. Rosa, do you want to touch on that one?
Sure. That is true. What is a suspended particle at one point can end up in the water, and vice versa, because water evaporates. So our systems aren't isolated. They all interact with each other, and as this really shows, it contributes to our health in a really strong and impactful way. So yeah. Yes. I'm just like, I'm so excited that we're on, that we're talking about this right now.
Yeah, and just, if I may just add to that, just like St. Mary's, no matter how much we think we're at the bottom of a peninsula, we're in our own bubble. We're not in our own bubble, as Rosa was saying before. Air flows around and so forth. But just like that, in an ecosystem, which is what we live in, things float between air and water, right? Particles evaporate and condense, and it's like the cycle of life, we call it, and cycle of ecology, where things that are in our air are influenced by what's in our water, and vice versa. So to put it very simply, I'm as excited as Rosa, because it's great to hear all these questions, because clearly people are thinking about this and are interested in this, and we think this data especially will help fuel further action for us here locally.
Yeah. And I hope that folks who are out there who might not be in St. Mary's County feel like this is inspiring, and that you can reach out to us because we've done it here in St. Mary's County, and and see this as sort of a beacon of hope for families who also don't know what their outside environment is and what are the pollutants that impact their environments. A lot of the air quality information that you can get from like weather.com is based on computer modeling around whatever sensors exist already. So until you have a community that's ready to dive into this head first and really look at these connections, you don't know what you don't know. So it's amazing to have these sensors, and there's so much we can learn from it.
Okay. Thank you. And I just want to say thank you to this dynamic panel of women. You guys are so awesome, and you did such a great job, and I'm so proud of each and every one of you. So thank you for taking the time with us this evening and explaining the benefits of the comprehensive air monitoring system that we have throughout St. Mary's County. It's always a pleasure talking to you, Dr. Brewster, and we appreciate all of your time and your hard efforts at ensuring health equity and environmental justice and promoting health efficacy within our children. That is awesome. If you need more information and you want to schedule a home visit, if you have a child suffering from asthma, please use the web address that was provided, www.smchd.org, or call 301-475-4330. And also, please visit the health department's website, www.smchd.org/breathe well, and help keep track and see what's going on with your air quality in St. Mary's County. Thank you everyone for joining, and breathe well, St. Mary's County.
Good night.
Good night.
Good night. Thanks, everyone.